Hi, everyone. My name is Luke Wilson. I'm one of our admission counselors here at the Massachusetts College of Pharmacy and Health Sciences. A very big congratulations to all of our admitted students and their families who are joining us today. In addition to that, I also wanted to say a very big thank you to all of our, current faculty, current students, anyone who is a recent alum or an older alum of MCPHS that is out there working in the field in these really difficult times. But without further ado, let's get to the task at hand here. All of you that are watching, this is our major spotlight specifically on the diagnostic medical sonography general track here at MCPHS University. And with me to help explain the program and give some more detail to it, I have both Professor Jennifer Miller and I also have a student, Erin McMenemy. If you would, I would love to have Professor Miller start off by introducing herself and then pass it over to Erin. So Professor Miller, please take it away.
Hi, congratulations, everybody. My name is Jennifer Miller. I am the program director for the General DMS program here at MCPHS University for the Boston and the Worcester programs. I've been in the ultrasound field for almost 30 years now. I really, really enjoy it, and I hope you will too. And I'd like to now turn it over to one of our current students, Erin McMenemy.
Hi everyone, my name is Erin McMenemy. I am a third year student here at Mass College of Pharmacy, and I am from Northborough, Massachusetts.
Wonderful. Thank you, both of you. Now, one thing I want to touch on before we start going over the question is, especially for you students watching, something that's really always difficult to really lock down is that component of social and emotional fit of a school. And something that's really great here is you actually get to talk to or speak with the faculties directly and one of our students directly. And that's really important because you want to make sure you're going to an institution where you like the faculty and you want to get along with them and you want to learn from them. And then on top of that, you also want to make sure it's a student body that you want to be a part of. So hopefully we get a lot of those questions answered for both of those areas and we check all the boxes for you there. So without any further ado, Professor Miller, I'm going to begin with you here. Would you please describe some of the strengths of the program and what makes it a great choice for students looking at us?
Sure. I think our biggest strength here at MCPHS is our faculty. Our faculty is so passionate and so caring. They love ultrasound and they love teaching it. It's really important to them that their students learn. Our classes are very small. There's never more than 20 students in a class. So we really get to know our students a lot. If they start to struggle at all, we really get to reach out and give them a hand. I think the second thing that sets us apart from other programs in the area is the time that our students get to spend in the lab actually scanning. They spend 12 hours a week in the lab for the first 2 semesters learning how to scan. They scan on each other, practice, learning how to actually work the ultrasound machine and get good images so that when they get to the clinical site, they know how to scan and they can concentrate on patient care and learning the pathologies. So I think that makes us really stand out. The last thing that's really important is we are an accredited program. So that allows our students to take their board exams 60 days before they graduate. So they can graduate with their diploma and their credentials ready to get a job.
That's all really great information. I'm glad you touched on all the hands-on experience that they're going to have access to. I think that's really important, especially when you're going into a career like this where it is so hands-on and the more, practice makes perfect, So thank you for sharing all that. Erin, I'm going to come over to you with the next question. Easy to ask, maybe a little bit more difficult to answer. Why did you end up choosing the Massachusetts College of Pharmacy and Health Sciences to study diagnostic medical sonography?
So I chose this school to study diagnostic medical sonography for the fact that it was an accelerated 3-year program and you get a bachelor's degree. I also chose this university because of its location. It is located in Boston near some of the biggest hospitals in our nation.
Wonderful. Thank you so much. And I'm glad you touched on that second point of location. I think that's really important for students to understand. You don't have to, drive 45 minutes to an hour just to get to a place that you're trying to volunteer or might have a clinical rotation at. It's literally out your door. which is kind of nice, saves you quite a bit of time and more time to study. So wonderful, thank you. I'm going to come back to you now, Professor Miller. Would you mind sharing what you enjoy most about teaching here at MCPHS?
I love watching it click for our students. You know, they come in and I think when you see ultrasound on TV, maybe you had it done on yourself, and it looks really easy. And when they come in and they start scanning it, you know, it's more difficult than it looks. And so I just love seeing that transformation of them as they mature. You know, they go from, you know, an 18-year-old kid just graduated high school to when they graduate with us and they're taking care of patients, and it's really rewarding to see how they change and grow.
That's wonderful. Thank you for sharing. Erin, I'm going to come back to you. Would you mind sharing some examples of how the program has prepared you for the next steps of your career in healthcare?
Sure. So before graduation, every student actually sits for and will successfully pass with Professor Miller's assistance the SBI boards exam. And prior to graduation, every student is eligible to sit for the abdomen and OBGYN boards exam 60 days prior to graduation, which definitely is a big helper in furthering your career in diagnostic medical sonography. Upon graduation, you can enter a hospital setting and hopefully begin your career.
Wonderful. Do you already sort of have an idea of what your plans are following graduation?
Following graduation, I plan to work in some kind of field of diagnostic medical sonography, hopefully in a hospital setting locally to me. I have not decided yet exactly which part of diagnostic medical sonography specialty that I will prefer to work with.
Okay, no worries. It's still plenty of time here. And besides, I'm going to have some other questions, and hopefully, over time, you can work with Professor Miller to try and lock that down. So, Professor Miller, I'm going to actually come back to you here. Would you mind giving some discussion to some of the faculty accolades and accomplishments that they've achieved already, and how that comes down and helps our students?
Sure. So our faculty is, like I said, their passion is ultrasound, and they love to learn. It's a field that it constantly is changing, and you just really have to stay up on the newest trends. So a few of us have actually gone back to school and gotten some advanced degrees. I'm one of them. I got my master's degree in health sciences. Another one of our professors just finished her doctorate in education. So we love to learn, we love to teach, and we love going to conferences, talking to other sonographers out there, and a number of us have even presented at national conferences. So
it's wonderful. I'm glad that you guys are still really active in the continuing education aspect too, because I think that's really important with how much healthcare changes so frequently. So it's good to be at the very cutting edge, if you will, of things you need to know. So thank you for sharing that. Erin, I'm going to come back to you, and we touched a little bit about things inside the classroom that you've done that are going to help you with your plans for afterwards. Would you mind talking a little bit more about things outside of the classroom that have helped you with preparing for those next steps, whether they be internships or volunteering you've done or clinical rotations or anything along those lines?
So in your third year of this program, you actually begin a clinical rotation, and your whole third year, you actually do clinicals. So currently I am placed in an abdominal-based clinical rotation, and then I will spend my summer in an OBGYN clinical placement. So I get a variety of sonography experiences.
Wonderful. That's great. Do you have like a favorite that you have done so far, or anything that, has really stood out to you so far?
I definitely like the overall just scanning the abdomen. I have gotten more experience in the vascular aspect, so I'm definitely getting a liking to that too.
It's wonderful. Excellent. Now, I'm going to come back over to you, Professor Miller. Would you mind sharing any additional opportunities or other things within the program that students should be considering while they're looking at us and looking at the progression through their academics with us?
sure. So to become a registered sonographer, you need to pass a board exam, a national board exam. So first part of that is passing physics, which is a word that tends to scare people, but it's not as scary. We break it down, and they pass their physics board before they start clinical. So at the end of their first professional class. So then they, at the end, right before they graduate, they're eligible to sit for another board exam, one of the specialty exams. Going through this program, they're eligible to sit for abdomen and OBGYN. We have other classes, pediatrics, MSK, vascular. It gives them an overview so that in the future, they can take those specialty exams once they get a little bit more experience. So it really opens up a lot of doors to them. Some of our graduates have taken advantage of the Advantage program here at MCPHS University, where they go on further to get a master's degree, maybe healthcare administration or health sciences. Some of our graduates come back and teach with us. We even had one just get in touch with us, one of our graduates from a few years ago, that she is applying to go become a sonographer in New Zealand, which is kind of exciting, you know, being able to work all over the world as a sonographer.
That's really interesting, and I'm glad that you touched on, you know, it's not just general. There are a lot of different specialties that students can begin to look at, you know, while they're going through their studies with us, and then it's an easy process of pursuing that down the road. So I'm glad you mentioned that specifically, because I think a lot of the time students get very linear in their thought process of what they want to do. So understanding that, you know, sometimes it is a bit of a winding road, but you need that for your own self-discovery. So thank you for sharing that. Erin, I'm going to come back to you here with one more question. Again, very easy for me to ask, but a little bit more difficult for you to answer here. Is there any, you know, key piece of advice or pieces of advice that you'd offer, you know, our admitted students that are currently watching right now?
Yes, so I definitely encourage every student to get involved here at MCPHS, whether it's joining clubs virtually or in person, hopefully, going to Cardinal days, just studying in groups, any possible way of just getting involved with other people.
Wonderful. Excellent. Have you been part of any of those clubs or organizations in the last couple of years? How have they helped you out throughout the process?
So I have went to many Cardinal days, which is sponsored by MCPHS CAB, which I did join a few of those meetings. I was not actually officially part of the club, but they are extremely welcoming to any students that decide to join in any of the meetings.
It's wonderful. Excellent. So yeah, people get involved. Now, I'm going to come back to you, Professor Miller, for one more question. Would you mind sharing some examples of outcomes for our students and what happens with the program after they wrap up?
Sure. So our outcomes are posted on our website. And as I said, they have to take two board exams, at least two board exams to become a registered diagnostic medical sonography. First is physics. Last year, our physics pass rate for our class was 96%. And I think the year before that was Erin's class, and they had 100% pass rate. So we're really proud of our students working really hard at physics. The students class of 2019, their OB pass rate was 90% and abdomen was 95%. And so they work really, really hard. We're pretty proud of our pass rates for our board exams. The last 2020 graduates who just wrapped up, every single one of them on graduation had passed at least one board exam. And right now, half of them have passed both of them. So they work really, really hard, and we're really proud of them.
That's really impressive to hear. So I don't want to go on and stretch this out any longer. I know folks get a little Zoom fatigued, and you know there's only so much screen time you can do. If anything, I want to express a very big thank you to Professor Miller and Erin for joining us and sharing some of your insights. And if anything, folks, again, congratulations, very big congratulations on getting accepted. And again, a very, very big thank you to all of our current faculty, current students, or alumni who are out there working on the front lines right now. It's really appreciated, and I know that's extended throughout, you know, the whole country. So again, very big thank yous for everyone. Very big thank you for Professor Miller and Erin especially. And Without further ado, you guys have a great rest of your day. And again, big congratulations. Bye-bye now.